In this video, we'll be discussing how cardiovascular disease impacts Aboriginal and Torres Strait Islander people in an urban setting and the health disparity they face in their day-to-day lives. An urban area is an area that surrounds a city. In comparison to rural areas, urban areas are well developed and populated. As cited by Brand, Bond and Shannon, Australia is one of the most urbanised countries in the world, with well over 2/3 of the population living in major cities. The number of Aboriginal and Torres Strait Islander people living in urban areas continues to increase. According to the Australian Bureau of Statistics, the Census for Population and Housing that was conducted in 2016 showed 79% of Aboriginal and Torres Strait Islander people were living in urban areas, whereas only 20% of the Indigenous population were living in rural areas. Australia's Aboriginal and Torres Strait Islander population migrated to urban areas in the 1960s and 1970s throughout the period of assimilation and self-determination policies. When Indigenous Australians first migrated to urban areas, non-Indigenous Australians segregated the Indigenous community and denied them access to community facilities and services, making it hard for Aboriginals to adapt to westernised health facilities with the inclusion of hospitals and general practices. There are different issues which affect Indigenous Australians' use and access to healthcare services based on the area they live in. When it comes to urban living, Indigenous Australians have a barrier for access to general practitioners as Indigenous people are reluctant to book an appointment and be confined to an environment they are not comfortable in, as opposed to rural areas where proximity and location are the predominant issues. According to Hampton, Toombs and Crawford, many Indigenous Australians attend Aboriginal medical service centres in the knowledge that the centre supports their culture and the staff will be welcoming and responsive to their particular situation. The Aboriginal Medical Service was created in 1971 to assist Aboriginal communities within Sydney with free medical services. Indigenous populations living in urban areas generally have inadequate access to culturally appropriate health service. Aboriginal and Torres Strait Islander people in urban areas have a better health status than Indigenous communities in rural and remote areas. However, there is still a significant disparity between Indigenous and non-Indigenous Australians in urban populations. Non-communicable chronic diseases, such as cardiovascular disease, greatly contribute to this disparity. There are several health services available within Sydney that specifically target the Aboriginal community, such as the Redfern Foundation that focus on the Aboriginal community in the inner city and provide support for healthy living and self-supporting. St Vincent's Hospital in Sydney is another health service available to the Aboriginal community as they provide support for inpatients and outpatients as well as their families and carers. The Aboriginal health team at St Vincent's Hospital work alongside the Allied Health team and focus on the hospital's Reconciliation Action Plan and work towards closing the gap with specific targets such as life expectancy. Within Sydney, there is an Aboriginal Chronic Conditions Network that work towards improving chronic conditions and the delivery of healthcare for Aboriginals and Torres Strait Islander people. In the Sydney metropolitan area, there are approximately 29 clan groups known as the Eora Nation. Eora means here or from this place. The original Aboriginal community that inhabited the city of Sydney are the Gadigal people who are part of the Eora Nation. The Gadigal culture survived the development of Sydney and collaborated with other Aboriginal communities around New South Wales to work, live, and create relationships within the urban community. In the 20th century, support systems and facilities were developed for the Eora Nation because of a growing political activism within Sydney. According to the City of Sydney, the suburb of Redfern was a particular focus to activism around civil and land rights for Aboriginal and Torres Strait Islander people. The territory that the Gadigal people populate stretches from Sydney Harbour all the way through to Petersham and out past Alexandra Canal and Cooks River. Health disparities refer to differences in the health status of different groups of people. Each group has different factors contributing to higher rates of disease, such as ethnicity, income, and race. Walsh and Kangaran found that cardiovascular disease is the leading cause of premature deaths among Indigenous Australians, with the disease claiming 25% of Aboriginal and Torres Strait Islander people's lives every year. During a study conducted during 2012 and 2013, it was found that Indigenous Australians were admitted to hospital due to cardiovascular disease at 1.6 times the rate of non-Indigenous Australians. The gap that is still experienced by Indigenous Australians is due to a variety of factors, including barriers to accessing healthcare facilities and affordability due to lack of bulk billing services. Health services targeting Indigenous Australians lack funding and resources to accommodate for the excess patient flow. When patients are diagnosed with cardiac conditions, they were often directed to hospital where medical professionals may lack cultural competency, and Indigenous Australians were open to discrimination and racism. When they are amongst a hospital environment, Indigenous Australians may feel a lack of support from family as they are isolated and reluctant to comply with healthcare expectations, such as making follow-up appointments and attending medical procedures. In such instances, Aboriginal liaison officers or a healthcare worker are pivotal to prevent instances like this from happening. Studies have indicated a greater mortality rate of Indigenous patients 6 to 12 months having been diagnosed with a cardiac condition compared to those of non-Indigenous backgrounds. There are several factors affecting the management of cardiac conditions experienced by Indigenous Australians relating to the social determinants of health, which include poor health literacy, family commitments, and cultural barriers. With high rates of psychosocial health, poor nutrition, and high rates of smoking, cardiovascular health will continue to remain an issue for Indigenous Australians. The National Strategic Framework for Chronic Conditions was introduced in 2017 to guide Australians to a healthier outcome for chronic conditions. The framework aims to focus on prevention and management of chronic conditions, targeting priority populations including Aboriginal and Torres Strait Islander people. The framework intends on reducing the disparity in chronic disease health outcomes for Indigenous Australians by 2025. The need of a culturally competent healthcare workforce is in high demand. Therefore, extra focus is needed on healthcare education for these communities to improve the competency of the healthcare workforce. A collaborative approach consisting of community partnership and health professionals will help to develop the needs of Indigenous Australians and implement the appropriate services and care. The framework aims to facilitate better data collection to allow a better understanding of the services that are needed to prevent and manage these chronic conditions such as cardiovascular disease. A combination of outcomes has been included to help close the gap disparity, of which include providing health promotion activities that are culturally appropriate, chronic condition information including prevention and interventions, inclusion of Aboriginal and Torres Strait Islander community leaders and elders to improve Indigenous wellbeing outcomes and quality of life, accessible, respectful, and culturally appropriate health services. In a study conducted during 2012 to 2013 in a major Melbourne hospital, it was found that Indigenous Australians responded better to cardiovascular treatment having had ongoing community and family support and rehabilitation programs in which were culturally appropriate. As previously mentioned, cardiovascular disease is a leading contributor of premature death of Aboriginal and Torres Strait Islander people in Australia. It is estimated that 30% of Aboriginal people and Torres Strait Islander people die from cardiovascular disease. The majority of Aboriginal and Torres Strait Islander people who develop cardiovascular disease die 10 to 20 years younger than the general population who get diagnosed with it. Mills et al. States that Aboriginal and Torres Strait Islander people are 3 times more prone to suffer a major coronary event compared to non-Indigenous people. These events don't just impact the individual in these situations, but affect their whole community in social, emotional, and cultural well-being. These figures show the health disparities between Aboriginal and Torres Strait Islander people and the general population. Some of the reasons Aboriginal and Torres Strait Islander people are more prone to cardiovascular disease is a lack of education of the risk factors that cause cardiovascular disease, and also what prevention measures can be taken to prevent it. Some of the risk factors Indigenous Australians have is the very high prevalence of smoking, which is 40% versus 18% of non-Indigenous people, as well as 18% have diabetes versus 5% of non-Indigenous. Other risk factors also include chronic kidney disease, psychosocial stress, obesity, lack of exercise, and hypertension, all of which will increase any person's risk of cardiovascular disease. All these risk factors mentioned all relate to low socioeconomic status of the Indigenous population. Another reason Aboriginal and Torres Strait Islander people have a higher prevalence of cardiovascular disease that non-Indigenous people have are barriers within the health system. Some of these barriers include transport and access to healthcare centres, cost of specialist treatment, and reluctance to go to healthcare services due to perceived discrimination. These barriers can contribute to the deaths of Aboriginal and Torres Strait Islander people from cardiovascular disease by not recognising the signs and symptoms or risk factors within their lifestyle and not allowing medical staff to implement prevention measures to avoid cardiovascular disease. The Aboriginal people and Torres Strait Islander people who live with cardiovascular disease have an increased amount of psychosocial stress, which can lead to a lack of motivation on carrying out normal day-to-day functions. This can lead to more effects of high blood pressure, stress, and can cause patients to be reluctant to seek medical intervention. It is common with people who suffer cardiovascular disease to get depression once they are diagnosed and get an onset of anger, anxiety, and sexual dysfunction. This can make it difficult for an individual to overcome cardiovascular disease and enable them to live a healthy lifestyle once they are diagnosed. This can lead to risky behaviour leading to an earlier death from cardiovascular disease. The government has taken steps to improve the social well-being of the Indigenous population by introducing the social determinants of health and closing the gap policy. By doing this, it brings awareness to the general population as well as the Aboriginal and Torres Strait Islander people, about their worrying concerns of the health disparities between the two groups. This awareness will lead to health promotions, education and preventative steps to improve the social well-being of Aboriginal and Torres Strait Islander people. Hopefully, by doing this, it will stop the perceived discrimination, allowing Aboriginal people and Torres Strait Islander people to seek medical intervention for any problems they may have. This will improve their quality of life, social well-being, and also enable them to live longer lives, allowing for Aboriginal people and Torres Strait Islander people to preserve and share their cultural knowledge through more generations. Aboriginal and Torres Strait Islander people embody the social, emotional, spiritual, and physical well-being of their communities, which is referred to as holistic health, allowing an individual and communities they are a part of to live a life of harmony. Psychological distress, such as cardiovascular disease, impacts on the harmony of holistic health for Aboriginal people and Torres Strait Islander people, which will affect the emotional well-being of the whole community that each individual is a part of. Hampden and Toombs states that Aboriginal people and Torres Strait Islander people living in an urban environment are more susceptible to socioeconomically disadvantage, which may lead to more health problems. This is due to a separation from traditional foods and exercise, which impacts their physical and cultural connection from the land, affecting the community's cultural identification. When members of a community within the Aboriginal people and Torres Strait Islander people die from health problems such as cardiovascular disease, it has a massive impact on their community. This can lead to financial, emotional, and psychological stress, especially if it is reoccurring disease, which is making community members die. This affects the holistic health of the whole community, which can lead to members of the affected community to participate in risky behaviour to cope, leading to more deaths and contributing to widening the gap in health disparities for the Aboriginal people and Torres Strait Islander communities. The word Aboriginal refers to the earliest inhabitants of a place. They are also referred to as Indigenous people. The term Aboriginal Australian is more of a definition to be taken in a social context rather than a racial one, whom has descended from their original inhabitant and is recognised by their community. For most Indigenous people, the phrase community is the feeling of belonging, where they feel valued and connected by other individuals and families in their environment. The Aboriginal people encompass a very distinctive feature in their culture, and that is one of a holistic approach entailing a harmony of mind, body, and spirit. Another fundamental dimension of the Aboriginal community is their relationship and connection to their land. They believe that their country or land is the place that has given them life and that one where they will also receive life after death. Indigenous Australians talk about their land in the same context that we, non-Indigenous, would refer to a person. Their spiritual connection to their land is one to be admired, but they have not always been so fortunate. Australia has had issues in regard to their land rights, as they were not granted citizenship until 1967, when a referendum was formed, which was 179 years following the colonisation by the British. A native title is the acknowledgement that the Indigenous people were the original founders and custodians of several lands within Australia. The native title was finally granted in 1993, which was led by Eddie Mabo after a long 10-year battle. Thus the land will remain inalienable, meaning Aboriginal land cannot be sold and will continue to preserve their land and claim their rights. Indigenous Australians' socio-economic status is a vital determinant in regard to their health. It is the foundation of their healthy food availability, employment, education, and access to their community health provisions. Approximately 3.4 billion people, or half of the world's population, reside in the city. The positive to urban living is the access to clean water, better infrastructure, employment, and education. Though several of these city dwellers are exposed to inequitable living conditions as they are on the lower end of the social gradient. With such a large advance in urban living, the growth in urban poverty has also increased, resulting in poor living conditions, malnutrition, and infant mortality. A vast number of Indigenous children and youth have not been so fortunate as their parents do not have access to adequate employment. Approximately 16% of Indigenous Australians are unemployed compared to 5% of non-Indigenous Australians. Although some businesses have helped by breaking the poverty chain and empowering the Indigenous through viable employment, ensuring their children have suitable education. In regard to education, 25% of Indigenous Australians are more inclined to not receive a school qualification. This is a huge disadvantage regarding their education, as it would have such a negative impact, resulting in disempowerment and limited life choices. With this being said, it is a continuous cycle of social isolation and poverty with subsequent ill health, high morbidity, and high mortality. These daily stresses can lead to many chronic diseases, including cardiovascular disease, diabetes, obesity, arthritis, depression, and high blood pressure. These chronic diseases in relation to lifestyle factors are rapidly expanding and is now the most significant cause of mortality, resulting in 63% of deaths with cardiovascular disease being the number one killer. The reality is that some of these chronic diseases could be prevented with a change of diet and more physical activity. A vast majority of our youth are not active enough to be deemed physically fit. Only 44% of Australians participate in any form of exercise, with only 14% of these being Indigenous. If we intervene and address these issues at a young age, with possibly educating our Indigenous youth in a school-based program, these alarming statistics relating to these chronic conditions will decrease dramatically. The term cultural competency is defined as the ability to provide care to patients with diverse beliefs, values, and behaviour, with the inclusion of meeting the patient's cultural, social, and linguistic needs. Cultural competency is an integral aspect when caring for a patient. It incorporates nurses acknowledging diversity to provide culturally appropriate care to maintain cultural safety within a healthcare facility. Aboriginals and Torres Strait Islander communities are more prone to be at a disadvantage in regard to their health. Cultural competent care allows Indigenous patients to have the ability to have a say over their health decisions. This shifts the power to the patient, which allows nurses to enhance a patient-centered care approach. Some training and psychology programs within Australia adapt the theory, understanding, and importance of the Aboriginal colonial history and the philosophies of power, considering the impact in regard to their provision of care and how it's received by their client. Safe nursing practice is imperative in our nursing role. It includes the improvement and maintenance regarding quality control, organising and caregiving, problem solving, connecting and educating the community, and also bridging the gap amongst the clinicians and administrative staff in a general practice. Safe nursing practice roles generally revolve around primary care activities, commonly in a general practice, focusing on the management of chronic illnesses. With the government reform introducing the Practice Nurse Incentive Program, with the focus on educating our Aboriginal and Torres Strait Islander community to manage and prevent their chronic conditions, expanding our role of safe nursing practice. In conclusion, as a group, we have learned about the impact of diseases that Aboriginal and Torres Strait Islander people within the urban community have struggled with. There is a lack of management and education in regard to their chronic diseases, including diabetes, depression, high blood pressure, and cardiovascular disease, thus has impacted their mortality and morbidity rates. We also have discovered the health disparity between Aboriginal and Torres Strait Islander people and the general population, and as nurses, we will do all we can to lower the health disparities while practicing in a culturally safe manner. With the Aboriginal and Torres Strait Islander communities being at such a disadvantage, we as nurses need to implement our awareness in a culturally competent manner and bridge the gap by educating and connecting with the Aboriginal and Torres Strait Islander community. While we are treating any Aboriginal and Torres Strait Islander patient, we will make sure there are no barriers that make our patient feel unwelcome, threatened, or unsafe. We are now aware about the role of Aboriginal liaison officers and will include them in our practice if we think it will create an even safer environment for our Aboriginal and Torres Strait Islander patients so they can receive the best possible treatment. We will also be aware of the psychosocial health of our Aboriginal and Torres Strait Islander patients suffering from diseases and will do everything in our power to maintain their holistic health throughout their treatment. In our future practice, we will continue to educate our Indigenous patients about healthy lifestyle activities and how to maintain the best possible health to prevent an early onset of disease. We will not only be educating our Indigenous patients, but we will also be educating our family, friends, and even members of the public where acceptable, to put a stop to the disparities between Indigenous and non-Indigenous people. Stop the early death rates, stop the perceived discrimination, and come together as one community. After all, extending the life of the traditional owners of the land is the least we can do to say thank you to the people who were most affected by our arrival on this great country.